What can I do right after birth, and how long should I wait? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. All right, so you've had a baby or you're getting ready to have a baby and you're wondering, what can I do right after birth? What should I do? When should I start it? I get asked this a lot from my patients. So I want to show you one thing today that you can do um, to help you reconnect in with your core muscles, with your pelvic floor muscles, regardless if you've had a vaginal birth or a C-section birth. Um, so I'm going to show you this in different positions, but basically it's breath work. Why do we want to connect in with the breath? Why is that so important? You might find that advice across, say, Google or social media. Why do us pelvic floor physical therapists or even personal trainers after birth focus so much on the breath? Well, if we think about the core really being more like a canister, right? A lot of people think of the core as, just the muscles in the front, that six pack ab, that kind of stuff, like six pack ab muscles, right? But really, the core is the diaphragm up here by the rib cage. Think of it like a canister. That's the top of the core, and then the bottom of the core, like the bottom lid, is the pelvic floor muscles. And then we have the front wall, the abdominal muscles. And really, when we're talking about the inner core or the deep core, we're talking about really the transverse abdominis here. And then we have muscles coming from the back that go between the bones of our back, called the multifidi muscles. With that, the core, the top part being the diaphragm, we want to focus on the breath because it's a big driver in how well we are managing, say, pressure into the rest of the core. So I tell my patients, think of it like the breath as being the driver of pressure that we're putting down into this core. So if we're not aware of it, we're not quite sure where that pressure is going. It's just willy-nilly, we don't know what's happening there. But we really want to distribute that breath so that we're not pressuring down and pushing down from the top and causing undue pressure into the pelvic organs. We also don't want to be pressuring out into the front part of that healing abdomen that's already been lengthened out from pregnancy. So, again, regardless if you've had a vaginal birth or a C section birth, but particularly with this, we don't want to be pressuring out into the front and causing a lot of push out into that healing C-section scar. We also don't want to be pressuring out into the back and maybe causing some strain or pain in the back. So we want to have more of an even distribution of that breath. And because the diaphragm, when we inhale, it moves down, and the pelvic floor muscles should also be moving down and lengthening, we want to already establish after birth a good connection with the breath, with your body awareness, because I'll tell you, even the most beautiful births are traumatic. They're hard on the body. A lot of changes have happened during pregnancy and during that birthing process. So we just want to reconnect and start to kind of activate or wake up those muscles again. So let's talk about the breath and how we can use this as a foundation to build up your inner core strength of the abdominal wall and the pelvic floor muscles, and how we can use that diaphragm to do that. Okay, I'm going to show you this in different positions so that you have some variety to practice with, okay? All right, let's get started. Okay, we're going to get started, and we're going to practice this first lying on your back. You can do this on a bed or even on the floor. Now, keep in mind, you can start this as soon after birth as you'd like to. We're really just working on the breath. So it can be done within hours if you'd like. You can wait a few days. But I would say you want to start on this within the first week to two after birth would be a good time frame. Okay, let's get started. We're going to move here to our back. So I'm going to lie down, and I would recommend having your knees bent. That way you have some support for your back, okay? And you can decide if you want a pillow or not. It's totally up to you. From here, what I'm going to have you do is find a neutral position of your pelvis, meaning I don't want you to be arched up or all the way back, so you're rolled back. I want you to be in a position where it feels like you're kind of right in that sweet spot between forward and back. So you can put hands on your hips and you can roll the hips forward and then you can roll them back and start just going smaller and smaller increments until you feel like the pelvis is in that sweet spot. From there, bring your hands to your lower rib cage. I'm just going to sit up here so you can see. So just the lower rib cage here. As I fan out, I'm just on my bony rib cage. And what you're going to do from there is you're going to inhale through your nose and try to breathe out into your hands. And then exhale out through your mouth and feel things come back together. So I'm showing you this in a sitting position just so that you can kind of see the mobility of my rib cage. And exhaling out through my mouth. Good. So again, if you're on your back in that sweet spot for your pelvis, hands here giving you some feedback, just inhaling through your nose, nice and slow. Exhale out through your mouth like you're blowing out through a straw. Inhale through your nose. And exhale out. So why we do that, inhale through the nose, it really brings that breath down and we're trying to breathe all the way around that rib cage. And then as we exhale out, the smaller you make that straw, the more the lower abdominal muscles and the pelvic floor are going to kind of zip up and give you just a little bit of support underneath. Okay, so give that a try in that position. I'm going to show you a second way to try this, and this is going to be on your hands and knees. Again, you can do this on your bed if you'd like, or on the floor. So I'm going to hop up here on my bed, and you're going to start on hands and knees in that tabletop position. So I'd recommend have your be up on your tiptoes, and you want your knee directly underneath your hip. So you don't want to be too far forward like this. You also don't want to be clear back. So you want to be up here, and hands are going to be up underneath your shoulders. So you can see how I'm kind of making a rectangle or a tabletop. From there, you can find a neutral position in this position. So you can arch here and arch back and make smaller and smaller like movements until you get to that sweet spot where you feel like you're nice and level. From here, I'm going to have you inhale into the rib cage like we did earlier, expanding around and letting the pelvic floor lengthen out as well. And then exhale out through that straw. Okay, and try again. So take notice, as I'm inhaling, my belly's dropping down just a little bit. And then as I exhale, it's coming back in towards my spine. Inhale, that canister fills up. And as I exhale, belly button draws towards the spine. So try that and see how that goes for you. Another position you can try this in is in standing. Know that it's going to be a little more maybe difficult for you starting out, but it is a position that likely you're probably in throughout the day, right? So it gives you ample time to practice. I like to use a mirror where you can see yourself and kind of line yourself up, stack your body in that good alignment, and then practice. So the mirror gives you some feedback that you can see yourself and make sure that you're doing things correctly. And also, of course, you can use your hands. So what I'm going to do here is just turn here so I can see myself in the mirror. And you can do this facing toward the mirror or even from the side. So what I would do is just stand with your feet about hip width apart, and focus in on your knees so that they're not locked out. You want to have a slight bend in the knees. Put your hands on your hips and you can find a neutral position of your pelvis, kind of rocking forward and back. And then just check to see, is your rib cage able to stack on top of that pelvis? From there, what you can do is bring the hands up to your rib cage and you can inhale through your nose, trying to expand out into the lats, allowing that breath to come down into the pelvic floor area, and exhale out through your mouth, letting things come back together. Inhaling in. So you can see how I'm not moving my back. So I'm not doing any kind of movement as I'm breathing there. Okay, so give that a try in standing and see how you do. All right, I hope that helps you if you are a new mom or in the final stages of your pregnancy and preparing for the next step. If you have any questions at all, if you want a little more guidance on making sure that you're doing this correctly or what else can be done in early postpartum to help you feel strong and confident and trust in your body again, please reach out here to the Healing Spot. You can head to our website, healingspotpt.com, fill out a discovery form or inquire about our services, and we'll be happy to answer any questions that you have and help you out. Thanks for watching this Ed Talk.